What is capsular contracture after breast augmentation surgery? Imagine getting a beautiful new look with breast implants, but then facing an unexpected firmness or shape change later on. That's what capsular contracture is all about. It's a potential complication that can happen after breast augmentation, especially when implants are used. To understand it, let's first look at what normally happens after an implant is placed. When a surgeon inserts a breast implant, whether silicone or saline, the body recognizes it as a foreign object. In response, the body naturally forms a layer of scar tissue around the implant called a capsule. This capsule is part of the healing process and helps keep the implant stable. Usually, this scar tissue remains soft and flexible, so the breast feels natural and looks normal. However, sometimes this capsule becomes abnormally thick, tight, or contracts around the implant. Instead of staying soft, it tightens and squeezes the implant. This can cause the breast to feel firm, change shape, or even become painful. The severity of this condition is often described using the Baker grading system, which ranges from grade 1 to grade 4. Grade 1 means the breast feels and looks normal. Grade 2 feels slightly firm but looks normal. Grade 3 feels firm and looks abnormal. Grade 4 is very hard, painful, and visibly distorted. Most cases of capsular contracture develop within the first 2 years after surgery, but it can happen anytime. Symptoms include increasing firmness, shape changes, discomfort, or pain. In severe cases, the breast may become hard and misshapen, and the implant might shift upward or become visibly uneven. The exact cause of capsular contracture isn't fully understood. One leading idea involves bacteria forming a thin layer called a biofilm on the implant's surface. This bacteria, often a harmless skin bacteria called Staphylococcus epidermidis, can trigger a low-grade inflammation. This ongoing inflammation may lead to excessive scar tissue forming around the implant. Even tiny amounts of bacteria that naturally live on the skin can sometimes enter the space during surgery and contribute to this process. Other factors that can increase the risk include bleeding around the implant, infections, implant rupture, especially with older silicone implants, and certain personal factors like smoking. Radiation therapy to the chest area, sometimes used in breast cancer treatment, can also raise the risk of developing capsular contracture. Plastic surgeons work hard to prevent this complication. They use sterile techniques during surgery, choose the best implant placement, often under the muscle, and sometimes use special materials or techniques designed to reduce scar tissue formation. Patients are also advised to follow all postoperative instructions carefully, avoid smoking, and refrain from strenuous activity during recovery. If capsular contracture does occur, treatment depends on how severe it is. Mild cases might just be monitored over time. More significant cases often requiring surgery to remove the thickened scar tissue, called a capsulectomy, and sometimes replacing the implant. Non-surgical options like massage or medications have limited evidence of effectiveness and are generally not standard treatments. It's important to remember that capsular contracture does not happen to everyone. Many women have breast implants and never experience this problem. If you are considering augmentation, discussing the risks, including capsular contracture, with a qualified plastic surgeon is essential. They can evaluate your individual risk factors and help you make an informed decision. In summary, capsular contracture is an overgrowth of scar tissue that tightens around a breast implant, causing firmness, shape changes, and sometimes pain. While the exact cause involves factors like bacterial biofilms and inflammation, proper surgical technique and postoperative care can help reduce the risk. If it does happen, treatment options range from observation to surgery, depending on how severe the condition is. Always consult a healthcare professional for personalized advice and care.